All right, everybody, this will be the last video of our clinical documentation refresher. I hope you have enjoyed these videos. Hopefully it will be able to spark, to remember when you're actually doing an assessment or any of these clinical documentation. But the last one we're gonna go over is the hefty pink packet. I know these things are redundant to say the least, but there is one thing specifically on a pink packet. Now, we all know pink packets mean restrictive intervention. It means that a patient either had a physical hold, chemical restraint, or a seclusion. So if you see a pink packet, think of those three things because it is a restrictive intervention and that is what you're documenting on. The one thing that always gets left out, if you see right here, it's on the front page of the pink packet. Everybody is pretty much checking off imminent danger to self or danger to others. That's being checked off. What is not being documented is the reason why we are completing this pink packet. There needs to be some kind of narrative here that explains the situation that caused us to have to resort to one of the restrictive interventions. So making sure that a narrative is put on there so that way when we look at these packets, we don't have to guess why somebody received a chemical restraint. It is written right there. Patient threw coffee mug on nurse or something to that matter. Next thing is on a pink packet on this entire thing, no blanks, please. A lot of information is being left out. Obviously, there's some information on here where it says, if it's just a chemical restraint, you can skip to the next section. Those are fine to skip. However, when it comes to the intervention that you completed, make sure that you are putting unable to assess or patient refused in like a patient debriefing. The patient's not responding to you what their triggers are or what they think they could have done better or what we could have done better. If you don't have those answers, you can put patient refused. That is acceptable. So making sure that those are completed on the pink packet. And if you don't know, a copy of the pink packet goes to, just make a copy of it. One goes to me and one goes to Amy in our risk manager. And if you don't know where our offices are or you have trouble locating them, please get with your nursing supervisor and they will actually take the packet and distribute it to the people that need this. So thank you. Next is going to be one thing that we have found is obviously think pink. Think if you have pink, you're doing a MIDAS entry. So know that every time that you have one of these packets, you need to be completing a MIDAS entry. It was an incident. An incident report is MIDAS entry. Another thing that's been kind of falling off is MIDAS entries being completed. For example, if we have an AMA and a MIDAS entry is not completed on an AMA, I'm having to every morning after there was an AMA on the shift before, having to go to medical records, find out why they went against medical advice, and we're doing detective work backwards. Make sure that you are putting in a MIDAS for an AMA, for a hospital visit, for property damage, for a boundary violation. If you see two patients holding hands in the lounge, that's an incident report. So making sure that you are always doing a report for things that you see that require one. Next thing is gonna be, when you fill out a pink packet, what's happening is when you get down to the MIDAS, we printed it out for you. Hopefully you can see it well, but on section I, it goes treatment or intervention given. If you filled out one of these pink packets, the treatment or intervention that you gave was a restrictive intervention. So what you'll do is you will click on treatment or intervention and it will pop down this bar. And there's a lot of people have either been clicking other or they've been clicking PRN medication. No, if you're giving chemical restraints, that is not PRN medication. That is a now order, and it is a restrictive intervention. So clicking that button when you have one of these pink packets. The next thing that's gonna prompt, if you click restrictive intervention, this will magically pop up. And what this is it was the type of intervention that you've used. The next thing we'll show is you either chemical, physical, or seclusion. Now, we all know that it could be more than one of those during a time of an event. So you can actually put all three and making sure that you are putting time applied, time removed. And I want you to know that a lot of times, if you're doing all three of these interventions, those times are going to be different. What time did you start the physical hold to give the IM restraint or the chemical restraint? And then what time did you let go of that hold to place them in seclusion? Because that would be the time that we discontinued the hold, but we began the seclusion time. So making sure that you're taking notes during code situations or just acute situations, and documenting that accordingly. And these should match up. They should be very similar. So finally, the last thing is at the very bottom of every Midas entry that you are going to complete, there is a description of event. This should never be blank. You should always put patient left AMA, stated, I wanted to go home, I have things to do. Patient threw coffee on nurses, not complaining of any pain, just an overview of what the situation was that required us to do a Midas entry. So again, just like the brief description in the pink packet, should be it doesn't have to be identical, but it needs to be very similar to the event that you place in the Midas entry as well. I hope that you guys learned something. Some of you probably maybe didn't because, you've been doing it right this entire time, but it's always great to have a refresher course and talk about our clinical documentation. It makes our patients more safe. It makes you more safe as a nurse, with liability and legal and everything like that. So we want to make sure that we're doing it right and we're teaching it right. And if you have or see anybody that's not doing it correctly, make sure to educate in real time. We're all each other's support and we all want to see each other succeed. So thank you again and take care.